Are you eating healthy and still not feeling well? Learn more on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got the beautiful Tina Nunziato sitting right here by me if you're watching us on YouTube. Thank you so much for joining us. We're so excited for today's episode, and if you are a new visitor to our site, we welcome you and we hope that you will stay with us on this journey and check out our podcast. We try to put something out every week. We've got over 400 episodes out there in our library. And if you're one of our regular listeners, we thank you and we love you. And we're so appreciative that you have been on this journey with us. So let's get started. This is actually a great topic. Is eating healthy enough? All right, is it enough? I mean, we have a lot of people, and I know recently Tina and I have both had conversations with people, not necessarily patients. It could be just clients or even family, friends that are talking to us and telling us that they eat really healthy, but they're still not feeling well. Mm-hmm. So what's that about? I mean, shouldn't we be feeling great if we're eating healthy? Mm-hmm. Yeah, I think we should, right?
For the most part, yes, we should.
For the most part, we should be feeling great, but of course, eating healthy means different things to different people.
That is definitely true.
Right?
Because I know the specific friend that we're talking about, when they say they're eating healthy, they might not be eating as healthy as, they think they are, but still, to that point, they are eating healthier than they usually do.
So then why don't we define what we feel is eating healthy so that we can kind of have that as a baseline?
Okay.
Sounds good. Go ahead.
Okay. Well, vegetables. Let's just start with vegetables, okay? Most people are not eating enough vegetables, right? You should be eating at least 2 to 3 servings of vegetables a day. Mm-hmm. So we usually try to start our day with vegetables. We'll do avocado with tomato on toast, or a rice dish with cucumbers, tomatoes, and avocado, or things like that, okay? So
our green smoothie
starts our day with greens, right? So you got to get your vegetables in. If you're not eating vegetables, then you are not eating healthy. That's the number one thing, okay?
Tina, do carrots and peas count?
No, carrots and peas don't count. Well, okay, so look, you can eat carrots and peas, but they don't count as green vegetables, okay? That's the first thing. And it is important to eat green vegetables. So I think that's the number one thing. I think just limiting the amount of red meat, dairy, animal products, right? Mm-hmm. Limiting those things. Like we do eat fish 2 to 3 times a week. So trying to do more lean proteins than high-fat proteins, I think, is just one step closer to eating healthy. The grains, trying to do whole grains. So like you and I, we used to eat a lot of like rice-a-roni, noodle-roni.
When we first got together, yes.
Yeah, and we thought, it's a,
hamburger helper. Well, we didn't do that, but our mothers, our parents did a lot of ham. Yeah, it was.
But like we were eating let's say, a piece of chicken with noodle-roni and broccoli, right? And we thought, that's a balanced meal. Mm-hmm. We're doing good, right? And then come to find out all the stuff they're putting in these packaged noodle dishes, these packaged rice dishes like rice-a-roni, really, really bad stuff for you, mm-hmm. right? So we started cleaning that up and just eating just rice, just jasmine rice, just brown rice, mixing it with greens, whatever. So trying to get away from those prepackaged grains and doing more whole grains is, again, one step closer to being healthier. Trying to do real fruit, mm-hmm. okay, if you're going to eat fruit, fresh fruit instead of fruit that comes in the little cups, right, for the kids, or the fruit roll-ups and all that. Again, anything that's processed, that comes in a bag, box, or can, that has more than a few ingredients, probably not the best for you, okay? So read your ingredients and try to eat real food as much as possible and as much greens as possible. The more greens you can eat, the healthier you're going to be, okay?
Very good. Okay, good. So that's a very nice baseline to start out with as far as what we mean when we're talking about eating healthy. Okay, eating healthy.
And drinking a lot of water, of course.
Yes, drinking a lot of water, cutting down on the intake of sodas, fancy coffees, energy drinks, anything sugary, like Tina said, processed junk food. Okay, so, and that's very important. And actually, I realize how much a lot of people don't really know this, because I recently had a patient in the recovery room. I said, listen, I need you to eat more fiber. And his question to me was, how about peanut butter Captain Crunch, the cereal? So it just made me realize, it actually made me sad. And I was like, oh my goodness, we really do have a lot of teaching to do, and a lot of people don't know. Okay, so great, eating healthy. Okay, so if you are eating healthy and still not feeling great, still having bloating or stomach gas, pain, reflux, constipation, diarrhea, then what? And this is what we want to talk about today.
Yeah, especially eating greens. So a lot of patients tell me, I can't eat greens. I can't eat a lettuce raw greens. Like, I can't eat lettuce anymore. I get really bloated. Okay. So I just stopped eating lettuce. Okay. Well, that's not good, right? Like, your body needs green food. I can't eat broccoli anymore because my body doesn't agree with it. That's one of the first things I start hearing is that people start having issues with greens specifically, and then they stop eating greens. Not good. You have to eat your greens. Okay. There's a reason why you don't feel good when you're not eating those greens. There's a reason why you're not feeling good when you're not eating any of the foods that you're eating, but even specifically if you're trying to eat healthy, okay? And that is, one reason could be food sensitivity issues. Yep. The other reason could be you're just not making enough enzymes to break that food down. So we just wanted to focus in and hone in on these two things. We know we've talked about these things ad nauseum, but related to this topic specifically, because I've had 2 patients this week and then our friend last week, who our friend had been on enzymes in the past, did really well on them, stopped them because they're young, right? And I always tell them, like, if you're young and maybe you've eaten a really bad diet, because a lot of our young kids are eating bad, okay? And then they start taking enzymes and they start changing their diet and they start feeling better when they change their diet. You can stop the enzymes. You should be able to stop the enzymes when you're young, okay? Now, if you're over 40, you really can't stop the enzymes. That's literally like, you're not making the enzymes anymore, okay? But this person is young. They said they were eating healthier. They didn't feel like they needed them anymore, okay? Okay, great. But now she's not feeling good again. And instead of going back on the enzymes, it was just kind of willy-nilly, and then we end up with being in the ER, okay? So look, the bottom line is that you literally might have a situation where you're not making enough enzymes to break down food. And no matter how healthy you eat, it doesn't matter. It's going to make it so it makes it difficult for you to digest, and you're not going to feel good. Right. It's so simple just to take an enzyme with meals.
Just to interrupt really quick, in case we have some new listeners or even established listeners that aren't sure what Tina's talking about with enzymes. She's talking about digestive enzymes, okay? Digestive enzymes, which we do carry these. This is our own product of digestive enzymes that we have available to anyone on our website. This is what's going to help digest. Your body makes digestive enzymes, okay? So we were born, in our body, we've been making digestive enzymes since we were little. But as we get older, we stop making the same amount of digestive enzymes. Every year or every decade, it goes down about 13%, okay? And there's multiple reasons for that. We're not going to go into that right now. However, the bottom line is that as we age, we don't make as much quantity-wise digestive enzymes as we need. And we're still eating, and it just means that you don't have enough enzymes to help digest. So that's what Tina's talking about. And that is a huge issue, and it's becoming a huger issue even in our younger people. All right. And part of it has to do with them not getting the proper nutrition that they need.
Yeah, because when we're young, and as we get older too, but it really does depend on the food you're putting in your body. The nutrition you give yourself is supposed to turn around to help your body make enzymes, okay? If we're eating a bad diet, makes it really hard for the body to make all the things it needs to be making to keep us well.
Right.
Enzymes is one of those things, which is why if we've eaten a poor diet when we're young, we get sick sooner, right? We're in the GI office at 20 years old instead of 40 years old, okay?
Right.
So, and then everyone asks me, well, what are these? What are in these? It's literally just the enzymes that your body should be making anyway, okay? There's all different enzymes that your body makes to digest all different types of food. There's a specific enzyme to break down protein. There's a specific enzyme to break down starch, sugar, dairy, greens, all these things, right? And if your body isn't making them, you can literally just take one capsule of this and it's going to replace what the body's not making so that you can start digesting well again. It's as simple as that. It's so simple, okay? But I don't know why people think, I don't need those. I'm just going to eat healthy. Okay? Doesn't matter. You could eat the healthiest diet in the world, but if your body is not breaking it down, you are not going to feel good and you are not going to benefit from what you're eating. So that's the other aspect of digestion. You eat food, it goes in as a solid, right? Your body can't use food in that form. It has to be broken down into a liquid. Enzymes and acid do the job. If you don't have enough enzymes, the food is going to move on partially digested. Think of it as like in chunks.
Right.
Your body can't absorb chunks. So you're not going to benefit from the food that you're eating. You're not going to get the vitamins and minerals. You could be eating a salad every day thinking, I'm doing my body good. But if you're not breaking it down, your body's not benefiting from those vitamins and minerals. It's almost like you're slowly malnourishing yourself, okay? In addition to now it causing digestive issues. So that's what brings people into the office is, well, I'm having reflux, I'm having heartburn, I'm having gas, bloating, constipation, diarrhea. Those are the symptoms of not breaking down your food well, right?
Yeah.
You don't feel the malnutrition part until later when you've been malnourishing yourself for decades, okay? That's why someone who's 20 years old isn't going to notice that. Okay?
Exactly.
But the other issue is food sensitivities. I mean, do you want to talk a little bit
Sure,
about that
absolutely.
aspect?
Yeah, the food sensitivity thing is such a crucial thing and something that has become a more prevalent problem. I'm going to say over the last decade or 2 decades, okay? Because when I started practicing gastroenterology, it wasn't recognized as much, okay? Like we weren't really honing in on, could you have food sensitivity? I remember we started dabbling in it when we started the practice like 18 years ago. And I was ordering like these blood panels that people could just get done at the traditional labs. And it was just a blood test. And if something would come back abnormal, then you'd be like, okay, you need to stop eating that food, do an elimination of that for a couple months. But what Tina and I started realizing over the last 15 years of taking care of patients and really focusing in on wellness is that, we were doing these full workups on these patients and they were still coming back with issues and, we'd get them started on enzymes and probiotics, but there were still some issues. They would get better, but there were still some issues. And then we started really pushing more so on, let's test you for food sensitivities. And a lot of people would be like, I know I'm not allergic to anything, or I've had some testing done and nothing came up. But we were like really focusing in on, you may not have an allergy, but you may have sensitivities to certain foods. And that could be causing some of your issues because it could lead to what we call leaky gut, where your gut is not, or it's actually could be a vicious cycle, really. You're eating these foods, your gut doesn't like it. Now you develop a leaky gut, and now it's just a vicious cycle of continue to eat these foods and your gut is not feeling well. So we started doing more food sensitivity. When Tina is talking, doing these consults, these nutritional consults with our clients, our patients, she was like really encouraging them to do more food sensitivity. And wow, were we shocked. Yeah, were we shocked. And patients and clients were shocked at how many things were popping up of them being sensitive, foods that they were sensitive to. But the magical part came in when they started eliminating these things that they were sensitive to. Okay, so not necessarily allergic, but just sensitive, eliminating these things, and all of a sudden they were feeling great.
And these could be healthy foods.
Yes.
So that's the thing. Like one of the things that I used to tell patients all the time is, eat an avocado every day. Okay. especially if you're looking to lose weight, because it's going to help you purge fat, right? People think the opposite. But that was bad advice for me, really, when I look back, because we've had several people come back with their food sensitivity tests where avocado was through the roof for food sensitivity. So here I'm telling somebody, eat this food, but yet their body's sensitive to it, okay? Now I'm very careful with giving food advice before we do a food sensitivity test, okay? I will always tell, they're like, what should I eat? What should I eat? And I'm like, you know what? I don't know. Because I don't know, if I tell you to eat an avocado every day, that might be bad advice for me, right? We have to do the food sensitivity test, and then we guide food based on that, okay? Okay, you can't eat avocados. Sometimes almonds come back high, and I'm teaching people, try to get off dairy, do almond milk. Well, we can't do almond milk because almonds come back high, okay?
Right.
And some people will switch themselves to almond milk or switch themselves to soy milk or coconut milk, and then they see that the soy comes back high, the almonds come back high, and I'm like, okay, we got to switch you to something else. So it's so simple, this test, okay?
Why don't you tell them the difference of this test versus like some blood tests that we order like at the typical standard lab?
I mean, look, it's the allergy tests that typically the traditional allergists are doing is they're doing skin prick and blood draws on people, okay? Skin pricks are really good for detecting environmental allergies like dust and weeds. They're not really great for getting at food, okay? The blood draw that they're doing, they're typically looking for food allergies, okay? Things that are going to make your throat close up, things that are going to make you get hives. Most people know what foods cause those things in their body, especially by the time you're an adult, okay? But the food sensitivity goes deeper. It's called an IgA/IgG test. It's getting at the tissue and cellular level of the body. So it's affecting you on the inside. You might not necessarily be feeling it through the skin or through, airways, things like that. So it's a finger prick test. We prick the finger, put the blood in a blood spot card, and send it in. And within 2 weeks, we have these results. And it gives people a very clear picture of what they should be eating and what they shouldn't be eating. And it's really good for people who've tried elimination diets. I mean, you could spend years doing elimination diets. And even that, it's hard to know, because sometimes you might eat a food today and it affects you in 4 days, not the next day, right? So it's hard to know with elimination diets, and they can take a really long time. This is a very clear road to the answer for people.
It's a really nice roadmap, and it really is incredible. And I can't tell you how many patients, and I'm sure you hear it, will come back and be like, wow, I was so skeptical about this because I know that I don't have allergies, but yet I got a list, a test for like 144, right? 144 different foods. And they're like, my thing came up showing like 25 things that never would I have guessed.
Yeah, they're things they eat all the time.
Yeah, so then go ahead.
Which is a clear indication that they have leaky gut.
Exactly. So then by eliminating those foods, and we're not saying that they have to go off of them forever, but they have to eliminate them to give time for the gut to heal up. All right, so the focus is get them off, let the gut heal, get them on probiotics, get them on enzymes, detox, let the gut heal. And then little by little, they can add one in at a time. That way, they could see how they respond to that as they add it back in. But it's a process, and it's just helped so many people.
A lot of patients, when they start feeling better at like 6 or 9 months, we'll redo the test again on them, and they'll see all those sensitivities go down. And they can start eating those foods again, which is awesome. But I always tell them, continue to take your enzymes, continue to take your probiotics, because it's going to help you break that food down so that we don't end up in this situation again. That's
right.
the goal.
That's right. So I know that so many of you are dying to know, what is this food sensitivity test? Well, you can find out. You can connect with us. If you go to our website, drlizcruz.com, there's a magenta colored button on the homepage. You can click it and schedule a free 30-minute wellness consult, and you can learn more about that on that call. And that call, again, it's free. You can do it from anywhere in the world because it's done over the phone, and learn more about this food sensitivity, learn more about the digestive enzymes, the probiotics, all of our supplements, and that way we can try to help you get on the road to wellness and feeling good. All right?
And you can do that test on yourself, and you can order it right on our website right now.
That's
if
right.
you just want to order the test, you can go to drlizcruz.com, order the test. We can ship it to you. You prick your own finger, you put it on the card and send it in. We'd get an email with the results, and I'd forward them to you. And it's that simple.
It's awesome. Well, thank you so much for joining us. If you have not rated us, please rate us and please give us a 5. It'll help other people just like you to find us faster. And lastly, if you've not subscribed to this podcast, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.